I have another question here for all of the candidates, I suspect, because it says, what do you feel is the benefits to having health premium versus PST, or health tax versus PST? So let's start with Stuart on this one. Looked up his notes.
You bet. Yeah. Like I mentioned before, the Wildrose Party is not in favor of tax increases, of any type of tax increases. We think that this province has enough money already. We already collect more in taxes and fees per capita than any other province in the country. The Wildrose plan for doing savings would include cutting cabinet in the size of the Premier's office, capping executive pay, reducing GOA managers by 33%, freezing manager salaries and saving $300 million, ending sole source contracts. Last year we spent $1 billion on sole source contracts. That's like buying a car without shopping around. Zero-based budgeting, stronger AG waste buster programs, 50% less AHS managers, consultants, travel, communications staff. And in fact, on average, according to the Eric Rosendahl from last year, we spent $23 million on communications staff, $107,000 each. And we've got about 11 of them per minister on average, not the one that Mr. Campbell said. And finally, we'd like to lower interest payments on debt by stretching the current capital plan from 5 to 6 years. Thank you.
Thank you. Okay.
Well, let's start with the PST, which has always been a dirty word in Alberta. When I came here in 1979, it was 100% against it. And as people continue to talk, I mean, we had lots of people lobby us to put a provincial sales tax on. And we said no. Albertans don't want it, so we're not going to do it. And the reason I didn't want to do it, I mean, for me as the finance minister, it was an easy fix. Because for every 1% of PST, that's $1.1 billion to the Treasury. So 5% PST, I have no deficit, I have no debt. We're balanced. But I made a commitment to people across the province that we would make sure that we got our spending in line within government, that we look at all the efficiencies we could to make sure that we're getting the best bang for our dollar in the programming that we're committed to Albertans about. And I also didn't want it, it's also I saw it as a regressive tax because seniors would have to pay it, low-income families would have to pay it, the most vulnerable would have to pay it. And we could set up a system where they'd get the money back at the end of the year on their taxes. But you know, when you're on a fixed income, as a senior, every dollar counts every month. You can't wait till the end of the year. A mother with 2 kids that's a single income earner, she needs that dollars every month. Sometimes that's all they have to eat. So we weren't about to put a PST on. When I look at the healthcare levy that we put on, we had a healthcare premium back in when I first came to Alberta, and it brought in about $1 billion a year. And again, it was regressive in the sense that everybody had to pay it, and we had to chase them down to get the money. What we've done is we've brought in a levy that will go on your tax at the end of the year, and you won't see it every month. We won't be chasing people to get it. And we've also made sure that low income and seniors don't pay the levy because it doesn't start kicking in until $50,000 taxable income. So that means you have to be making about $75,000 a year before you start to pay the levy. And it's progressive, starting there, going. So if you're making $50,000, you would pay about $2 a month, and that would be on your taxes at the end of the year.
Thank you, Rob. Eric?
Well, I don't know which is worse, health premium versus PST. PST hurts the economy, it hurts our buying power when you go to buy something. That's not really fair either. Health premiums, that's a penalty. We call it a waiting room tax, is the way the NDP look at it. When do you pay it? When you go there and hopefully you can see a doctor and you gotta pay or whatever. Mr. Campbell says it's based on a certain amount of income, I suppose, but we certainly don't believe that. The biggest problem that we have here in this province, it's not a spending problem. It really isn't. When you look at other jurisdictions across Canada, we pay about 10, just over 10% of our economy is based on our services. You compare that to Ontario, Quebec, like I said, we've got the lowest on what we pay. So what is the problem? The whole problem here is revenue. That's why we've got an issue. Depending on the dollar royalties, what's that going to pay? If the oil prices are way up, it's okay, but when they drop like they have, how are we going to provide for our services? And then they say, well, okay, let's have this health premium if you're got so much taxable income. Well, that's still unacceptable. We have our resources, they belong to us. And we should be getting fair value for it. And we shouldn't have to have either one of these if it's been properly managed. They've had 44 years. And it still isn't right, is it?